Hey everyone, my name is Misty Roberts. As the president and founder of Medical Patient Modesty, a non-profit organization that works to educate patients about their rights to dignity, privacy, and freedom from abuse in medical settings. I am very concerned about the zero visitor policy that was implemented at many hospitals in America due to COVID-19. A similar policy could be implemented again in the future for another pandemic.
The zero visitor policy is too extreme, and it is a violation of patient rights. While I understand the important responsibility that has fallen on hospital administrators to help control the spread of COVID-19, they have failed to understand that most asymptomatic family members are much less likely than the hospital employees to have COVID-19. Medical professionals are seemingly at a higher risk of contracting COVID-19 than the average person because they regularly interact with numerous sick patients. However, it was very encouraging that most hospitals allowed pediatric and obstetric patients at least one visitor. The truth is, all patients have the same rights to visitors. Screening patients' visitors, such as taking temperatures, special questionnaires to determine exposure to COVID-19 or any other contagious illness, and requiring masks and protective clothing would be a better solution. Even the most empathetic medical professional cannot give the same personalized attention as a patient's own visitor due to the fact they have many other patients to take care of. Every patient must have the right to have a chosen person with him or her at all times. Technology cannot substitute for in-person interaction, respectful advocacy, and the protection from abuse, despite best efforts by hospitals, which can only be guaranteed by the constant presence of a loved one. The inability for patients to have a family member present with them as they recover has many consequences that hinders the overall recovery. Some of the consequences are loneliness, lack of comfort, wrong or missing medication due to staff shortage, no one to advocate for patients' wishes for modesty, and numerous other issues, etc. Numerous patients prefer their family member, especially a spouse, to help them with personal care such as bathing and dressing. Those patients should always have their wishes honored. Too many patients have been forced to recover or even die without one family member present due to this policy. Here are a few examples of sad cases that were affected by the zero visitor policy. 1. A man had an accident at work that seriously injured his hand, and he required surgery. He was required to stay in the hospital for a few days, and his wife could not visit him at all. She did not have COVID-19. 2. A man had a massive heart attack and spent over a month in the hospital before dying. The zero visitor policy went into effect a few weeks later, and his family could not visit him much at all. Sadly, he passed away alone, without the presence of his wife and his 2 daughters who did not have COVID-19. The horrible zero visitor policy should never be implemented at any hospital or doctor's offices. Medical facilities need to be patient-centered, and this includes allowing a patient to have a support person with him or her at all times. Every patient has the right to have a support person with him or her at all times. We must challenge any policies that prohibit patients from having their chosen support person to be with them at medical facilities. I want to talk about another important issue concerning surgery patients. Medical patient modesty encourages all surgery patients to consider having a personal advocate, such as a spouse, family member, or friend, not employed by the hospital to be present with them in pre-op, operating room, and post-op, especially if they will be under general anesthesia or there is a chance they might be sedated. Too many surgery patients have been violated. For example, unnecessary pelvic exams and unnecessary urinary catheters without consent under anesthesia. Look at our website at www.patientmodesty.org to see some examples of surgery patients being violated. A personal advocate is great at helping to hold the surgical team accountable and ensuring that they not ignore the patient's wishes for modesty and many other issues. The patient advocate can also make sure that the surgeon is not substituted with an inexperienced surgeon. Inexperienced surgeons have caused numerous patients to die during surgery. Having an advocate present would also help to cut down on medical mistakes, sexual abuse, and deaths, because the surgical team would be observed by a personal advocate. We need to fight against hospital policies that prohibit a family member or another person the patient chooses from being present during surgeries. Choosing to have a personal advocate present during surgery should be the right of every patient for any surgeries. For many years, husbands were not allowed to be present for their wives' C-sections. A number of people challenged this policy, and it started changing in the 1970s and 1980s. We all need to push hospitals to allow surgery patients to have their chosen person with them during surgery. For example, a C-section is major surgery. To be present, husbands are asked to put on scrubs and shoe coverings for the wife's procedure. These same requirements could be followed for other surgeries and procedures. I encourage everyone to check out our article, Why You Should Have a Personal Advocate for Surgery, on our website that lists some arguments medical professionals may use about why you cannot have your chosen person present for your surgery and how to respond to those arguments. I also wanted to encourage you all to watch our videos, Surgery and Your Modesty and Problems with Medicine Being Gender Neutral on www.youtube.com/patientmodesty. Another serious concern is that a number of hospitals in America still have the policy that no underwear can be worn for all surgeries, even those that do not involve genitals, such as surgery on the neck, throat, nose, hand, and knee. Patients have the right to wear 100% cotton underwear, disposable underwear, or even adult diapers for many surgeries. Fortunately, some hospitals have abandoned this horrible policy. We all need to challenge any hospitals that still have this policy. Look at the article, Unnecessary Underwear Removal for Surgeries, on our website. For procedures that require access to the groin or hip, cover medical garments can be used. We have booklets about how women can protect themselves in medical settings, brochures for men about how they can stand up for their rights to modesty, and brochures about how medical professionals can be more sensitive to patient modesty. We would like to distribute as many of them across America. We need more funding to reach out to more people. I wanted to encourage you to consider supporting medical patient modesty financially and volunteer by helping us to distribute those booklets and brochures. Look at our website, www.patientmodesty.org, for more information.